Information Officer at the Minnesota Department of Health, and we'll go ahead and get started. Thank you for coming to this webinar. Right off the bat, I want to thank our partners in this, the Minnesota Newspaper Association and the Minnesota News Media Institute, for helping us to put this on. We have a nice selection of reporters from all over the state who've decided to attend, and we thank you for that. Minnesota Department of Health consider data collection and data tracking about health one of our core missions, and the reporters and the media really help us get that information out. Today we'll hear from Injury Epidemiologist Supervisor John Raisler and Injury Epidemiologist Supervisor Gene Johnson. I meant Environmental Epidemiologist Supervisor Gene Johnson. And then we'll have some time for questions. A few housekeeping. If you have a question, use the chat button, little bubble up there. You can submit your question when we're when the speakers are speaking, and then we might not get to them till the end. And then afterwards, we have a very short survey that we'll send you that we hope that you fill out. Without that, Gene Johnson will go ahead and get us started.
All right, thank you, Scott. And I think it's red. Sorry. I'll just start that again, that slide. Minnesota Public Health Data Access comes from the CDC's National Environmental Public Health Tracking Network. That's what funds this work that I'll be describing. 25 states and New York City are part of the network. The network was created to help inform actions that promote healthy communities by providing access to data and making it easily accessible, because we know how difficult it is with so many environmental programs and so many health programs, each one having different data sets in different places. The network was created to try to pull that together in one place, environment and health data. It also provides nationally consistent data so that states are collecting data in the same way so that you can make some comparisons from state to state. And it provides information through a network of data portals. So the Minnesota Tracking Program monitors trends, disparities, and geographic patterns looking at environmental hazards, exposure, and public health. And I'll be sharing with you data in each of those areas. coming up in just a minute. Again, it's to inform policy. We hope that the folks who access and use the data are using it for policy, assessment, planning, accreditation, grants, training, research, and community engagement. And we aim to serve a wide variety of audiences, including local public health, nonprofits, policymakers, the general public, and the media. This is just a screenshot showing the main page of the National CDC Tracking Network. They also maintain a national portal of data, and as the arrow in the upper right shows you, they have links from their main page to all of the state grantee portals, including Minnesota's. So this would be one way of finding Minnesota's portal as well as other state portals would be to go to the CDC national page, and you can also see comparison data across the states from that page. And you can see they have their portal divided up looking at environments, population health, health effects, and info by location. So we're going to stop here, and before I go to our state portal, start with just a quick polling question for the audience. And then we'll be answering this by going to the data portal. So a topic that's been in the news quite a bit lately has been childhood blood lead poisonings. So the question we have for you is, what % of kids under the age of 6 were tested for blood lead in Minnesota in 2015? What would you guess? Is it 10%, 20%, 45%, or 60%? And you can mark your answer on the right-hand side. You should see on your screen, you can click on your selected answer and hit submit. Just going to wait a few minutes for people to answer the question. All right. And it looks like people are still answering, but it looks like the majority of you have said between 10% actually, or 20%. All right, well, we'll look for the answer for that when we go to the portal, which is the next thing I'm going to show you. So again, the portal is called Minnesota Public Health Data Access. What's that? There's several ways that you can get to the portal. Box in the upper right-hand corner, you could enter Minnesota Public Health Data Access in that search box. You could also go to Data and Statistics and click on that, and it will open up a few options in there, including Minnesota Public Health Data Access. And what you're going to be looking for is a page that looks like this, Minnesota Public Health Data Access. I'll be going there live in just a second, but I did want to show you that this is the page we're looking for the portal. Another way to get to it directly would be just go to healthmn.gov/MinData. If you have another screen you want to look at while we're doing this and try to follow along, that's fine. You could also do this on your phone. It is mobile responsive, and you can look at it. It will look different from what I'll be showing on my screen. All right, so while you're looking for that, I will switch over to my desktop. Now I am live on the Minnesota Department of Health webpage. I'll be going there by looking at data statistics. And from Data and Statistics, Interactive Data Sources, I will be choosing Minnesota Public Health Data Access. And that opens up the data portal. So once here you see we have about 24 different data topics. And you can navigate. I'm just going to go through the navigation quickly. You can either navigate topics directly alphabetically. You can navigate by category. Categories are child health, climate, diseases, environmental health, health behaviors, and healthy homes. And you can navigate data by region, which gives you data at the county level. So I'm going to start by picking, again, childhood blood lead. That was the question we just asked, so I'll choose that topic from this all data topics list. Childhood lead exposure. And with each topic, it starts with a main page that gives you basic information about that topic. So for lead, for example, you get basic information about what is it, what are some of the risk factors, steps to prevent lead exposure. And on the bottom of each page, we have lots of links to other programs and what's being done about that particular issue. So, for example, a link to the MDH Lead and Healthy Homes program would give you a lot more information as well. Okay. All right. So to answer the question that we just asked about annual blood lead testing and what % of kids under age 6 have been tested. So we're going to look at view charts is one way of getting at data. We're going to go to annual blood lead testing. Facts and figures. And if we look down, we find children tested in Minnesota annually by region, and by region it's greater Minnesota metro area and the state as a whole. And what you can see on this chart is, and again, these are interactive charts, so if you scroll over them, these dots will give you the actual percentages, will give you the data. The green line is Minnesota as a whole, and as you can see in 2015, about 20% of kids under age 6 had been tested in that year. So if you answered 20%, that was correct. These charts, I also want to show you, you can click on the tabs and see the data underlying the chart. You can click on other information. This shows testing rates for children under age of 3 or tested before the age of 3. You can see the testing has been increasing over the years. This is good news. So that's one way to navigate, is by going through view charts, and you'll have lots of different options in view charts of things that you can look at. Another way to look at the data is you can look at the Explore Data tab. This gives you another mapping option, interactive map, and it also gives you a data query option. If you go to the data query, you can do some customized looking. So let's look at elevated blood lead levels. And when I click on that, it opens up some other choices. I can choose the 5+ micrograms per deciliter. That's the current reference level by which we define an elevated blood lead. If I choose that, and this time I'm going to choose by birth year, the cohort method. This looks at kids born in a year together. And I'm going to choose the year 2012. So these would be children born in 2012, tested before the age of 3 in Minnesota. And this pulls up the data that shows me about 80% of kids born in 2012, tested before the age of 3, were tested. Of those 80% of kids that were tested, that was a total of 55,000 kids tested. Of those, 531 were elevated. You'll notice at the bottom there are buttons here. You can download the data. You have that option. And of course you can go back and change your query, reset. Another option under Explore Data is the interactive map, and I'll be showing you a new feature we just added to the portal very recently. The interactive map, as the name suggests, you can scroll over and it pulls up information for each of these counties. This is a county level map for childhood lead exposure 2012 birth year. So kids born in 2012 tested before the age of 3. And what you're looking at here is percent tested by county. So St. Lake County, for example, 98% of the kids were tested, compared to Minnesota overall, 80% among children under 3. If I want to look also at percent of those kids that were elevated, I switch my tab here on the right hand in the key to percent elevated. Here I get a map showing whether those elevations are the same, lower, or higher from Minnesota as a whole for elevated blood lead. So Hennepin County, for example, there were 192 elevated blood leads, or about 1.4% of those kids tested. So testing in Minnesota is not universal. It's not a requirement. Not all kids are tested. Some other important features of the interactive map to show you, there is the table feature. If you click on the table, you get quite a bit more data can be found in here. So for each county, children with elevated blood lead levels, the percent of children with elevated levels, the number tested, percent tested, and the risk factors, children in poverty, pre-1950 housing, pre-1980 housing. So there's some more information in the table underlying the map. And finally, the tools feature on this map gives you have Zoom capabilities, you have download, and you can also download as a PDF. So that's the interactive map feature. To go back to the topic, I just click on childhood lead exposure on the left-hand side. It takes me back to the main topic page. The tab on the right, About the Data, is a very important tab for understanding where the data come from, what are the important limitations that you want to know about it. So if we open up limitations, for example, it kind of explains the fact that blood lead testing is not universal or randomly sampled. So that's an important fact to keep in mind when looking at the numbers. This is important for the interpretation. So I would encourage you to look at About the Data. So let's switch to another topic just to show some other features. I'm going to go back to the home page this time. I'm doing on time. I just want to keep track of the time. It's about 1:18. Okay. This time I'm going to pick another topic that we've developed some new content, and that's drinking water. So drinking water, if you look under View Charts for drinking water quality, you'll see that we don't have all the contaminants in here. We have about 6 different contaminants, as well as in public water supplies, as well as private well arsenic. So for example, disinfection byproducts or haloacetic acids in Minnesota community water systems. You can get information about what are these contaminants. What have the levels been in community water systems? You can also explore data, and this is where we have some new components now. We have a new interactive map, and you can zoom in on this map, and you'll see it has all the community water systems now show up as a dot on the map. So if I click on one of these dots, so for example, this is the Becker water system that serves the city of Becker and Sherburne County, primary source being groundwater, population served 4,720 people. This just kind of shows you all the systems that are there. If you go to the table underlying it, again, you get more information, and it gives you the public water supply ID. If I want to go more in depth, I can go to the query drinking water query allows me to now go to a specific water system, such as, so this is Ada in Aiken County, the 12 High Mobile Home Park. That just happens to be the first one that comes up. I can select the year, select the contaminant, and it gives me the contaminant level mean and max for that contaminant. Actually, and this is showing all the systems in Aiken. So that's a new feature, is the new query that allows you to see all the community water systems data for those 5 or 6 contaminants. And we'll be over time adding more contaminants to that. We also have an interactive map for private wells, but this is arsenic levels in private wells. Okay, another topic just to show, we'll switch over to a health-related topic now. Take a look at cancer, one of the more popular topics that people search on our portal. And it is a leading cause of death in Minnesota. If you go to view charts, so the Cancer Registry actually collects data on over 80 different types of cancers in our state. We have 19 of those on the portal. We're slowly working to add more, but this does give you quite a bit of information. So for example, if I click on lung cancer in Minnesota, similar to the other topics, you get basic facts and figures, you get the disease by year, race, ethnicity, age, and you can see what the trends have been over time for lung cancer. So like I said, this is a topic that people look at. We have a few interactive maps for cancers, and we have a data query as well. So you can select a cancer type and look at it by county. Next, I'd like to just quickly show you a county profiles feature. This was a feature that was extremely important to our local public health. They use this quite a bit. It allows you to look just at the data specific to a county. So if I pick Aiken County, it's going to open up all the topics for which we have county level data. So we have county level air quality data, county level cancer incidents, lead, immunizations, oral health, population characteristics. This includes things like income, insurance, poverty. Radon is a new topic we added in the last year. And you can see you can get by county the rates of the properties that are tested, percent of properties tested that exceed 2 picocuries per liter, and the percent that exceed 4, which is the test standard for mitigation. Reproductive and birth outcomes includes infant mortality, birth weight, premature births, and again, drinking water quality. In this case, for the county level, it's looking at arsenic. So that's a useful feature. Our Get Help is a place where you can look for a quick reference guide that we have on this that you can download and print. All the topics. We also have an About page with more information about the portal. And a Contact Us. If you are not able to find what you're looking for on the portal, several things, certainly this email that you see on here, health.dataportal, is one way to reach us. Our phone numbers are here. You could also use our data request form. This is another new feature. Opening the data request form. I'm going to show you that on a slide later. And of course, we're very interested in your feedback. So we have a little feedback tab here with a 4-question survey. All right, I'm going to show you one more topic that's new that we've just added. And that is traffic. Because motor vehicle traffic is a public health issue, and so this is a new topic we're starting to build, and we'll be expanding on this. It is a major contributor to air pollution. It also contributes quite a bit to injuries, and we'll be adding some injury data to this as well. We measure vehicle travel exposure based on people living in proximity to busy roads. And we were able to look at socioeconomic disparities in traffic exposure. So it's probably not surprising that there's a link between poverty rate and exposure to traffic. And this is another one where we have now recently added a census tract map. So this is new as well, that we can look at traffic exposure by census tract. We know a lot of communities want to see data at their community level, and we try to bring that where we can. And again, this is traffic, proximity, people living, percent of people living in proximity to traffic by census tract. So I think the last thing I'll show you is just along the very bottom is you'll see that for every page it says subscribe for min data updates. As we continue to update the portal, we would encourage everyone to put their email address. This will get you added to a listserv for any updates as we add new content to the portal. All right, and with that, I think I will go back to the slides. All right. Again, I showed you where to find this on the Contact Us page. This is our desk reference, which we encourage you to download, put it up on your bulletin board, and then we'll continue to update that as we add more topics. And the data request form. If you don't find what you're looking for, you want to make a specific request, we will do our best to, if we don't have the data, we'll do our best to try to connect you with the folks who do. So we would encourage you to use that as well. Finally, there's my contact information with the Minnesota Tracking Program, and of course the MDH Communications Office, Scott Smith or Doug Schultz are good contacts. And we have a suggested citation if you do use the portal in your stories or in the newspaper. We would appreciate it if you did access the portal that way. That helps us know that the portal was useful. And so that ends my presentation. I'm going to turn it over to John Russler.
Greetings, this is John. I am really glad to be here. It was fun to look at the registration list and see several reporters there who have interviewed me on numerous occasions. So for some of those reporters, and usually and typically what I often try to do when reporters call me is to take them through these different data systems and teach them how to become armchair epidemiologists. So that's really my goal, to empower and enable you to find these things. But I'm happy anytime that you want to contact me to talk about the data. I'm happy to try to identify what the answerable questions are. This is part of what I do as an epidemiologist, is try to figure out, so how can we reframe a question into something that we can actually get an answer to, where we can actually get some data that will help us understand and guide our thinking about a problem that may be in our society. So there's my contact information, and I'm calling this, you only need one slide for running your own analyses of deaths. And here's the one slide. as we go in. These are the four main data sources that I take people to when they're looking at mortality. Now, I work in the injury and violence prevention section, and so I'm mostly used to looking at homicides, suicides, gun deaths, motor vehicle crash deaths, and also non-fatals. But these are the four fatality web pages where you get information. The top two that are there, IQ and the Vital Statistics Annual Summary, are from the Minnesota Department of Health. IQ stands for Interactive Query, and I'll tell you what the power of this one is compared to the federal ones, and also the Vital Statistics Annual Summary, is that there is not suppression of small numbers on this. You can get the actual number of deaths even if it's less than 10, even if it's less than 5, even if it's 3, 2, or 1. And that's because death certificates in Minnesota are public information. And so you can drill this data down and find out, if it's a very small number at a county level, et cetera, you can find that. Flip side is that IQ is not as powerful as some of these interactive federal ones, namely Wonder and Whiskers. You will really only get the number of homicides, the number of suicides, number of unintentional. You can't drill it down to gun deaths or motor vehicle crash deaths or poisoning deaths or things like that within IQ. However, you can do that with the federal ones. The Vital Statistics Annual Summary is basically, that's just a PDF, and that's the official statistics that come out of the Minnesota Department of Health, broken out for the most part down to the county level. Lots of tables, lots of numbers, sometimes useful for finding something that you can't find in other places. So that's an occasional reference that I use. Now, moving on to the federal data sources, the two that we'll be looking at, Wonder, which is really the most powerful. It's got graphing capabilities, it has mapping capabilities, but it's also fairly complex interactive query system, and does take a little bit of working with it to get used to it. Once you've mastered it, it will answer lots and lots of questions and be able to provide lots of comparative data, whatever your story might be on, and trying to get a sense of the bigger picture. Whiskers is specific to injury. Wonder is really for all causes of mortality. There's also some demographic information that you can get from Wonder, which I won't be talking about today. But Whiskers is restricted only to injury and injury information. However, it does also have leading causes of death, which includes non-injurious forms of death, and we'll be looking at that as we go through. So that's your one slide. Get your screenshot, whatever it is. This will get you your information for doing your own queries. If I was going to give you a second slide, here's the second slide. The first web page, and this is a Minnesota Department of Health web page, is for MIDAS, the Minnesota Injury Data Access System, and that's for hospital-treated morbidity and mortality. It does include people who died in the hospital. However, it's probably not real good for counting mortality overall, because a lot of deaths, especially injurious forms of death, such as suicide, homicide, motor vehicle crash deaths, never even make it to the hospital. And the proportion that make it to the hospital is actually a subset of the total number of deaths, and so then you'd want to use one of those previous ones, IQ, the Vital Stats Summary, Wonder, or Whiskers. The other data set we'll look at briefly today is the behavioral risk factor surveillance data, and we'll look at an example looking at mental health data. So here's our basic outline of what I'm going to go through. We're going to look at homicides by year, and then homicides by mechanism, looking then at leading causes of death coming from Whiskers, then hospital-treated self-directed violence coming from MIDAS, and mental health indicators coming from the BRFSS, BRFSS, Behavioral Risk Factor Surveillance System. So here's homicides by year. You go to wonder.cdc.gov. That's I've got that one. Boy, that comes off the fingers pretty fast. Put that into my address bar, and I go right to it. And so I'm giving you a set of screenshots to help so that when you get a copy of these slides, if you want to walk yourself through it, you can. But as you come into the original, this is the home page for Wonder. And you go down, if you want to count deaths, you go down to mortality. And usually I check and go search the detailed mortality. Sometimes I'll also look at things like the multiple cause of death tables. For example, if I'm looking at poisoning and overdose deaths, and I want to find out how many heroin-related deaths there were, I would go in and use the multiple cause of death, because technically you don't, the way the coding system is set up is that you don't die of heroin, you die of a poisoning overdose, and then as a supplemental cause, then you will have heroin listed. You may also have fentanyl, you may have benzodiazepines, etc. Associated with it. You're going to get that all from this multiple cause of death. But right now, we're just going to focus on this detailed mortality, because we're going after homicides. How many homicides do we have in Minnesota? And just before I leave this page, you will also see underneath the mortality section, there is a population section. That's where you get some demographic information on Minnesota and other states of the nation. Then you come to this screen after you click on the mortality, and this is you, basically you agree that you're not going to misuse this data, and that if you inadvertently identify a individual, that you will basically not misuse that. Going into, after you click the agree, you come into the interactive part, which with multiple tabs and multiple sections. So the first tab is the request form, and in the request form, the first section is to organize your tabular results. And what we're going to look at here is the number of homicides by year. So I open up the list there and scroll down to year, which I've circled. We go on to our next section. Then you'll also want to do, of course, as epidemiologists, we always like to calculate rates. And now also to give you a sense, these are not, when we look at this, the number of homicides that occurred in Minnesota. These are the number of homicides that occurred to Minnesotans. A little bit different. If you want to know the number of homicides that occurred in Minnesota, you would get that from the BCA, the Bureau of Criminal Apprehension within the Department of Public Safety, or some other places also have the number that occurred in Minnesota. But we look in public health, we look at the number that occurred, we look at homicides that occurred to Minnesotans, and then we can calculate a rate because the denominator is all Minnesotans. We like doing it, and then we like to age adjust it from, if we're looking at comparisons over year, because our society is aging so rapidly, and we usually standardize to the US 2000 population. So we'll calculate, and we hit that checkbox of age adjusted rate. Then we go down to section 2, and we select a location, and here I've got circled Minnesota, and I have selected Minnesota for this analysis. You can also run this all the way down to the county level by clicking the open box after you've selected Minnesota, and it will give you the list of counties, and you can select a county such as Hennepin, Ramsey, St. Louis County, etc. There is small number suppression within within Wonder. It will not give you numbers, I believe, less than 10. It will not. It suppresses rates for numerators less than 20. So if you drill it down too far, it's going to suppress everything. It's going to suppress the numbers. So going on then to the next section on this, section 6, I select the radio button there, injury, intent, and mechanism. And then using the drop-down listing, I select homicides. And then going all the way down to the bottom of that interactive screen, I squeeze send. And then we see what we get. And then we get our table by year, the number of homicide deaths. And this one we kind of select because we actually bumped up in homicides. It had come down for a number of years, bottomed out there in 2009, and has kind of bounced around a little bit, but then 2015 is a high year for Minnesota. And we see there, so looking at 2015, which I've circled in red, we see a total of 147 homicides amongst Minnesotans, no matter what state they died in. And that gives Minnesota a rate of 2.8 per 100,000. Just for reference purposes, I also did that same calculation for the United States. And we see 2015, we see in the United States there were 17,793 homicides for a rate of 5.7. So right there you see that Minnesota's homicide rate is about half that of the U.S. rate. It was 2.8 for Minnesota, 5.7 for the U.S. These are age-adjusted rates so that you're kind of comparing apples to apples and oranges to oranges. You get a sense of where Minnesota's homicide rate is compared to national. Okay, then we continue on. We want to make a graph now of this, so we go over to the chart tab at the top of this interactive query. And just to note over there as well, there's an export feature that you can kick this this tabular data out into a, I believe, a comma-delimited spreadsheet, import it into Excel if you want, and then you can do your own manipulation with this data, do your own graphing, give it to your graphics people to do things with it, etc. And there we see our rate again of 2.8 per 100,000 for 2015. Let's continue on. And we get this graph. This is the default graph. It presents the data with horizontal bar charts, which is a good way for presenting categorical data, but this, well, technically year is a category. We usually think of years in more of a linear trend, which we usually represent on a horizontal axis. So we want to change this, and there are chart options, which I've circled there, and we're going to go in and we're going to pick some of those chart options. Now, one of the things we want to do, instead of looking at the rate by year, we want to look at the number of deaths by year. So that's the first circle. The second circle in red there, we select a line chart, and then we're going to change this from a horizontal chart to a vertical chart. Click on that, and then we go to the fourth red circle there in the lower right, change the chart, and what do we get? Drum roll, huh? Okay, here it is. Those are the deaths by year, and so we can see this sort of linear trend, which bottomed out there in 2009 towards the end of the Great Recession, and then while there is year-to-year variation, we see since 1999 basically a very high number of, the highest number of homicide deaths occurring in 2015. Now, I hate to go too far into the weeds, but here's why Wonder goes only back to 1999 on this feature, is that they changed the coding system in 1999 from the ICD-9 to the ICD-10. We are currently using ICD-10 to code death certificates, and that was done in 1999. There is another option within Wonder. You can go back and look at the number of deaths and rates, etc. Prior to 1999, I believe it goes from 79 to 98, and that uses the coding system ICD-9 for that. So, but the CDC, who develops this Wonder, doesn't let you put all those in the same table. Okay, continuing on then. One of the kind of nice little features that I use sometimes, you can, if you're just doing a quick representation of the data, you can grab this chart, you can copy it, click on the graph, and then right-click and copy it, and you can drop it into a report or into, as I've done right here, into a PowerPoint graphic, etc. Okay, so now we're going to look at homicide by mechanism, again using Wonder. We go back to the request tab. So we've done this, we found the number, but now we're interested about, okay, so what proportion of these are gun deaths? And so then in number 1, section number 1 of the request tab, we open up this grouping results drop-down menu, and we're going to select injury mechanism and other leading causes. So, because we're interested in these guns, and that's a mechanism. And we see then go down to tab number 6, and we again select the radio button, injury intent and mechanism, and then with the drop-down menu, homicide, and then off to the right, we're going to take all the injurious mechanisms and see which mechanisms were used for homicides. And then we squeeze send. And looking at, here are the results then of what we get, and this is national number now. We're not looking at the Minnesota data, we're looking at the national number. So we see that from 1999 to 2015, there were 295,000 suicides for a rate of 5.8, and just in sheer numbers, we see this 198,760 firearm deaths. Where we want to graph it, we want to make a chart. So we click on the chart tab. We get the chart. Again, now we see a horizontal bar chart, and we see that the firearms grossly exceed any of the other mechanisms that are being used. Now let's go look at leading cause of death, and this is coming from Whiskers. After you click in, this is the opening page for Whiskers, and you'll want to go to the fatal injury data, which I've circled in red. And then you'll go to the leading causes of death, 1981 to 2015, which I've circled in red. You click on that. And then, now they break it out, and you can see there, again, they break it out and they tell you 1999 to 2015 is ICD-10. 1991 to 1998 is ICD-9. We're going to look at and click on that option of 99 to 2015. And then, again, you have to agree that you're not going to misuse the data. And then you can submit the request. And this is the kind of table that you get. Circled some items of interest on this with more of a focus on suicide. This is Minnesota, and we see in an age group of concern where there's been an increase in suicide deaths is this 35 to 44 age group, and we see that suicides is the 3rd leading cause of death in 35 to 44-year-olds. And overall in Minnesota, suicide is the 9th leading cause of death. If we look at it for the U.S., which is our next slide, we see in the U.S., in that age group of concern, 35 to 44, and again, this is a concern because this is where a lot of the increase in suicide mortality is coming from, and for which we are not doing a lot of interventions as a society at this point. We see nationally, suicide is ranked 4th. In that age group, and overall for the country, suicide is the 10th leading cause of death, as compared to 9th for Minnesota. That's significant, and this points out the different metrics. You know, you don't always compare what's Minnesota's rate compared to the U.S. rate. When you look at suicide, Minnesota suicide rate is just a hair under the U.S. rate, and you say, oh, it's not as bad a problem in Minnesota. But when you look at the ranking, in terms of leading causes of mortality, you see that it actually ranks higher in Minnesota than it does in the U.S. Moving on then to hospital-treated self-directed violence, and this is using the MIDAS data system now. So we can click on that link. And we go in and we see injury data. Now there's 3 modules currently within MIDAS. And we're going to select that first module, which is injury data. There's also violence data. And Jean mentioned, looking at traffic data, you can see where it says CODES data. That stands for Crash Outcome Data Evaluation System. That links hospital data with the Department of Public Safety crash data. And you can do more in-depth analysis of motor vehicle crashes and other deaths, such as with pedestrians, bicyclists, etc. That data is only current through 2012 in there. We're working on making it more current, but just giving a plug for that CODES data module within MIDAS. We will also be adding some additional modules to MIDAS, one on behaviors, one on drug overdose. Those are in development right now. So trying to be able to answer more questions. But right now we're going to look at the injury data. We're going to look at non-fatal self-inflicted injury. So we go in there and we select all mechanisms. And then we're going to look at self-inflicted in terms of the manner or intent. We then also need to select a data set year. 2015, we've got, right now, it's just got the first 2 quarters of 2015. There have been some changes to the system. We're in the process, and I had thought by now we'd have all of 2015 and the first couple quarters of 2016 uploaded. That is imminent. That should be coming up very shortly. We need to select under Minnesota regions. You can select for the whole state of Minnesota. And given our previous selections then, where we selected the type of, or the manner being suicide, all mechanisms, non-fatal, because that's the strength of this MIDAS data, and then we can squeeze submit over there on the right. And oh yeah, we also want to get numbers or rates that comes out, and it kicks out this table at the bottom of the page, which gives you a breakdown and rates by age group. And we can see the overall age group there. No, you probably can't see it because I can barely see it. It's, I think, 67 per 100,000. You can also go into violence data to look at self-inflicted, well, suicidal, kind of the full realm of suicidal ideation and injury that occurs within the hospital context, or that rather that comes to the hospital seeking care. So this is self-directed violence, but it includes suicidal ideation, not just people who are injured. So this is broader. It captures the injuries, but it also captures the suicidal ideation of people who are brought into the hospital. And so I've got circled there the year, and now this one, it does show that we had 2015 quarters 1 through 4. We had it up briefly, had to roll it back to back just to the first 2 quarters as we're trying to get that data system refined. We select state of Minnesota, we select self-directed violence, we combine types of care in terms of ERED and hospitalized only. We bring those together. A lot of self-inflicted harm or suicidal ideation is dealt with in the emergency department. And then we do age adjustment, and then we go over here to the right and we squeeze submit. And we get our tabular data, again, down at the bottom of the page, and we see the age group breakdowns, and we see the rates. And now we see a much larger rate of about 723 per 100,000. So there are a lot of people with suicidal tendencies who are showing up at the hospital on an order of 10 times the number who are showing up with a self-inflicted injury as they come into the hospital. Now, to be clear, these are not all suicide attempts. This also captures things like cutting behaviors and other self-inflicted harm, people who are thinking about hurting themselves. So this is very broad in its definition. Now, going on to mental health indicators, the last data set that we're going to look at, we're going to go to what we call, or which is commonly referred to as BRFS, the Behavioral Risk Factor Surveillance System, BRFSS, which does contain Minnesota data. You go into that main page, and now we're at CDC's BRFS page, and we see over in the left hand there, there's a prevalence data and data analysis tools. We click on that, and then we can click on the chronic disease indicators. I believe this page has changed since we took the screenshot on this, but you'll still find the chronic disease indicators. And then you can select on Minnesota using the drop-down menu, and you click Go. And you get another drop-down menu in terms of which BRFS indicators you want to select. And we're selecting mental health thinking in the kind of the suicidal realm a little bit, and we click Go. And you will get then these 3 tables that are kicked out behavioral risk factor data for Minnesota for adults age 18 and older. And gives you different mental health indicators that are collected by BRFIS. You will notice when you go out and use this BRFIS tool that Minnesota doesn't have any data out there for those under the age of 18. And that's because Minnesota does not participate with CDC's Youth Behavioral Risk Factors system because Minnesota has the Minnesota Student Survey, which is maybe another webinar or another discussion or a phone call from you to me if you want to look at the Minnesota Student Survey. That data is online, but it is not on the CDC BRFIS website. And again, the summary of our data sets that we've looked at: Wonder, Whiskers, Midas, BRFIS. We also looked, we didn't look at IQ on this, but that's another available data set. And thanks from Jean and John here as we go out. And now I think we can look, we got enough time to do an interactive query for the real thing. And so we can look over here and then we go ask the question, what proportion of gun deaths are suicides? So this is a little bit different than what the question we asked before, which said, okay, out of all the homicides, how many were gun deaths? Now we want to know, out of all the gun deaths, what proportion were suicides? So you can make your pick over there, and then we're going to do an interactive query and find the answer ourselves and make a graph. So we have people checking on this, and give just run out to about 45 seconds, then we will move on. Here we go. Okay, so we see a dispersion of answers of what you think. Let's go find out. So now, let's see. I got to figure out how to go out to the interactive part again. Here we go. Okay, so we're going to go and find the answer from Wonder. So I just go out to the address bar, wonder.cdc.gov. You're going to see us do it, and we're going to say, okay, we're going to look at detailed mortality. You've got all the slides. I've taken you through this, and we are going to organize this now by, we're interested in injury intent. We're going to do our breakdown by injury intent, but we're going to do it only for gun deaths that occurred in Minnesota in 2015. So we're going to select Minnesota. We're going to take all ages. We're going to select just 2015. And we're going to come down here in section 6, click on the injury intent and mechanism button, and we're taking all causes of death, but we are going down to this drop-down menu, injury mechanisms. We are really only interested in the firearm death, so we select the firearms, and then we send it. And so we get this number, suicides and homicides, but we go, okay, so John, where's the percentage? Where's the proportion? So we can click on chart. Here's the default. We get a vertical bar chart. And now just to let you know, there are some legal intervention deaths. There are some unintentional gun deaths, but there is small number suppression that's going on right now. So the only thing that the CDC software, Wonder software, reveals to us is the suicide and the homicides. But let's put these two, suicide and homicide, into a pie chart, which will give us the percents. So we go up here and we select pie chart, and we're going to take down here under pie chart options, it's already defaulting to percentage, and we can say change chart. And here we get our graph. We can see homicides was 24%, and suicides is 76%. So that's the 75% number was the closest to what we're getting. A lot of homicides in 2015. We have seen this number for suicides as high as 80% or maybe even low 80s. Most gun deaths in Minnesota are suicides. And this is a very interesting phenomena that, you know, we don't always perceive this as what's happening because these suicide deaths are not reported on very appropriately. And just to give a plug for how to report on suicides is that we don't normally report on the mechanism that is used by suicides or in suicide deaths because that introduces a fair amount of contagion. And people who are experiencing different levels of psychopathology becoming more empowered and enabled to actually kill themselves when reporters have given the mechanism. We're working on a paper now and trying to get the analysis done, but we saw this very clearly with the Robin Williams suicide. And there was really way too much detail that was provided. I understand it was newsworthy, but the number of hanging suicides has been noted to really increased after the Robin Williams suicide and the reporting on the mechanism. That was, and I don't, you know, I don't quite know how to, you guys deal with the ethics and and how do you do this, but there was definitely a contagion effect as a consequence of the Robin Williams hanging suicide that really bumped up both the number of suicides and the proportion that was due to hanging. Okay, so that's basically my presentation. We are going to go to questions. Let's see what questions are here. And if there's something you want to see us do, either Gene or myself, we are glad to do it. Any questions out there? Otherwise, I'm going to toss this back to Scott. Oh, do they tell you when data is suppressed in Wonder? The answer is, I believe so. They will tell you. So, let's see. They, right here, charts only include data with a numeric displayed with the results, excluding all hidden values such as suppressed. And so if we go back to our results page as well, for example, this suicide says rows with suppressed deaths are hidden. And you can show the suppressed rows where they have suppressed the data, and you can see that those numbers are suppressed. One of the ways to get around and away from the suppression issue is then to aggregate more years. So we looked at just 1 year, which is going to get you into some small ends. But if we want to look at the, say we're more interested in the unintentional, we can look over say a 5-year period. We can take 2011, 12, 13, 14, and 15, resend our data. And now we're not getting the suppression of the numbers. Unintentional, there were 19 over a 5-year period, so on average a couple a year. And we see some the undetermined and the legal intervention that come up. And just an aside, I know legal intervention is a very newsworthy topic, and we do count within Wonder and Whiskers, we do count legal intervention deaths. I'm getting a little bit into the weeds now, but this is probably not the best data system for looking at legal intervention, because the number that you will find here is probably less than the roster. No, it is less than the roster that you would find for the same period of time that is maintained by the Star Tribune online. And that number on the Star Tribune is going to be even less than the number that we collect with the data system NVDRS, the National Violent Death Reporting System. Minnesota's first year of data for the legal intervention is 2015. We are in the process of finishing up the 2015 year data, but I anticipate that we'll have a paper coming out looking at the legal intervention deaths with the data system. David Hemingway from Harvard School of Public Health did an analysis of the NVDRS and found that that is your best data system for counting legal intervention deaths. So, sorry, went into the weeds too far, but we'll go back into where we were before. And you got it. Up here, here we go. And which one do I click on? Share.
Sharing, stop sharing. To the left.
To the left, stop sharing, got it.
Red button.
Red button. Okay. So that addressed probably more than you wanted to know, Stephanie, about do they tell us when data is suppressed? Other questions?
All right, then I think we'll wrap it up. Thank you all for participating, and please call communications. If you ever need any help, you can call me. My areas are sort of chronic disease and health policy and senior care and nursing homes, and Doug Schultz is environmental health and infectious disease. Keep an eye out. We're going to send you a brief survey. I know surveys, we're all inundated with surveys. This one's short, super easy to complete because we want to try to make this training as good as it can be. Okay, thanks a lot, everybody.